I think communicate with your PT and other PTs you may work with.
Respect, I think that means being able to work with PTAs as a team member and not just seeing them as like an assistant, but seeing them as someone who can help me on this rehabilitation team, help a patient progress to get better.
I feel it's important for PTs to understand PTAs because I feel like that is probably less focused on, and that puts them at a crutch to where they may have a benefit by having a PTA to help them, but they may not realize it if they're not fully aware of our capabilities. Ours program specifically is 18 months. The normal programs, the average programs are about 2 years. We have a large majority of the same prereqs, anatomy, physiology 1 and 2, physics, med term. We then go into the program and we have first 2 semesters would be class time, getting the large chunk of the education from the textbook. The second half of the program is largely clinical based, so we have 14 to 16 weeks of clinical experience, and following those we graduate shortly after. We have a small semester in the fall of additional classes, secondary topics, but the second half of the program is largely clinical experience based before we enter the field. During mobilizations, we are taught extensively on practicing on how to actually perform those properly. However, we are only performing grades 1 through 3. Grades 4 and 5 are performed by PTs. We're taught in therapeutic exercise, we're taught how to make appropriate modifications, progressions of exercise, all staying within a appropriate manner for each patient's situation, while being able to differentiate between a too tough and too little amount of progressions to challenge them appropriately without making it too difficult.
So some of the advanced proficiency areas can be acute care, cardiovascular or pulmonary, geriatric, oncology, orthopedic, pediatric, or wound care management. So during the advanced proficiency, I would actually be working with a PT who is specialized in that area. It also requires 2,000 hours of clinical experience, which is when I would be working with that therapist.
Honestly, no. I mean, I wish you can get all that through just like book learning and looking up online, like, oh, here's how the interaction should be. But when it comes to like the social interaction and working as a team, that's more one of those things I think you have to develop in person at the clinic. Well, there's no doubt as like a new grad physical therapist that coming in and working with someone that has 20 years of experience definitely has a wealth of clinical knowledge, and negating that would be a horrible mistake on my part or any PT's part. So I definitely think it'd be more of like a give and take. So you learn from their experience and then give them independence, and then they can learn from maybe like some of the new material that you're bringing or that I'm bringing in.
I fully agree with that. I think that's a great way to go about it. I think there's a lot of communication that needs to happen from the new PT grad and the PTA to find the best middle ground on how they both want to go about treating patients. So the PT would need to make sure the PTA knows how the PT wants things done from his perspective, because the PT would be the one signing off on the notes. At the same time, not negating the fact that the PTA would have the experience and may or may not have even better ways to go about treatment-wise. So it's really important, I feel like, to take the give and take, as you said, of 20 years of experience from also the new textbook knowledge and the in-class experience that the new grad would have.